Hello everyone, hola, and thank you for attending this session. I'm here to tell you about Spaces for People programme, a transport infrastructure response in Scotland to the COVID-19 pandemic. My name is Paul Cronin and I'm Head of Programme Assurance and Implementation at Sustrans Scotland and a programme lead focusing on skills and delivery challenges for this piece. I'm a civil engineer by trade and lead the delivery of engineering works as well as the distribution of technical advice. So what is Space for People? Space for People is a response in Scotland to the challenges from COVID-19 pandemic. Its vision was to expedite temporary infrastructure across the country to make it safer for people who choose to walk, cycle or wheel for essential trips and exercise during lockdowns and as a result of restrictions put in place to manage the spread of the virus. It aimed to enable statutory bodies through money, expertise, influencing to implement measures that focused on protecting public health. The programme was guided by key themes, enabling safe physical distancing for essential journeys and exercise for everyone, in particular where there are space constraints or user safety concerns. We set out to make trips possible and easier to and from hospitals and health services, as well as shops, pharmacies and schools for key workers, and for recommended exercise, for example, neighbourhoods and local parks. Immediate delivery. We needed to focus on fast delivery so we could provide a visible improvement that is an immediate benefit in a time when many people felt afraid and needed to see action, and we organised ourselves accordingly. So what did we do? We provided a rapid and agile system to respond to our partners' needs and ideas. This included working with 36 local authorities, mostly local authorities, but also health boards, to bring just over £33 million to the transport sector as part of the pandemic response. We directed skills and expertise to support the advice and project delivery and to expedite implementation in a way that helped ensure quality, user-focused solutions on Scottish roads and streets. We supported local authorities through things like identification of priorities by offering skills around some network planning and engagement, design through delivery of concept and detailed general arrangements, implementation, so support of procurement, contract management and supervision of contractors, and monitoring, communications, feedback and interpretation of data. This key offer with a relatively small operations team delivered in excess of 150 projects and work packages to support the expedited implementation of on-the-ground interventions that opened our streets up to people in a way that supported their freedom to get out, see some normality, to get exercise, and ultimately to support their health and well-being. We needed to show the way, help paint the picture of success. A key item we needed to articulate was what good looks like, and the fact that good changes across time. The first 6 months can be rough and ready, but for truly transformational change, our impact needed to evolve with changing needs of local people and communities. We needed to think what partners needed in a step-by-step way. We created design guidance. Our guidance was comprehensive, allowed designers to move from objectives to how-to, and we set out route maps, flowcharts from idea to implementation. These delivery route maps allowed project managers to plan for the key protocol and avoid delays. To date, we have mapped 904 interventions delivered as part of Spaces for People. Interventions include 882 kilometres of cycleway, 52 kilometres of footway widening, 32 kilometres of road closure, and a huge impact outside of our schools, 172 kilometres of 20-mile-an-hour streets, and 67 kilometres of vegetation clearance, all to create more space for people. Thinking safer and protected cycleways, and remember the timelines, the planned evolution of quality mentioned earlier. Cones at the start, then bollards, and we see planters, from rough and ready to something of real value to local people. Thinking of footway widening, simply the needs targeted on the key streets. Thinking of road closures, the scale of reallocation of road space for people to enjoy these places that was previously being car dominated has been incredible across the country. Thinking of 20-mile-an-hour zones and how this has been embraced by local authorities in a time when streets needed to cater for the vulnerable. And what is next? How can we build on the changes in travel behaviours in the months and years to come? Make this normal. Knowledge sharing has been critical and a huge part of our impact. Can some of these changes become permanent? At present, a huge number of schemes are seeking paths to permanence with only bureaucratic and technical challenges remaining. Monitoring and analysis will be critical. Consultation, longer-term plans, creating sector that thrives on experimenting with new ideas and a legal framework that supports this. and everyone learning the importance of engaging people early and thoroughly to bring communities with us and help share the vision we share for cities, towns and villages of the future. Thank you and obrigado.